Here's what's really scary for us. A lot of parents out there, fentanyl-related overdoses between 2019 to 2021, 800% increase for 10-year-olds to 19-year-olds.
The way these things are mixed by the criminals is so inconsistent. It's just very, very dangerous.
We do have a life-saving medication that will reverse an overdose when someone experiences that, and that's naloxone.
I'm Deborah Tuff, and this is Upfront Gwinnett. Thank you so much for watching. On this final episode, we're examining how the county is tackling the fentanyl crisis, one community, one person at a time. Here for this very important conversation are Lieutenant Jake Smith from the Gwinnett County Police Department, Dr. Audrey Arona, CEO of Gwinnett, Newton, and Rockdale Public Health Department, and Daryl Corder, who is with Viewpoint Health, a counselor who not only is helping folks overcome this very sensitive issue, but you did it yourself, and we're going to get to that. So let's get this conversation started. We've heard in the past few episodes, the past 3 episodes, from a mom whose daughter had an accidental overdose. We've heard from Dr. Terry about the death rates. But now let's talk about solutions. Let's talk about, as a community, what we can do. Dr. Arona.
Well, first of all, fentanyl is 50 to 100 times more potent than morphine, right? And so everyone needs to understand that this is just a different animal, right, than we've ever faced before. But we do have a life-saving medication that will reverse an overdose when someone experiences that, and that's naloxone. So, my solution is really, we need to flood our community with naloxone so that when these overdoses happen, that someone has this life-saving medication that will reverse that.
Daryl, when folks come to you, by the time you see them, they are seeking an answer. There is a desire to change. Have you had any folks who have suffered from fentanyl or who've actually lived through a fentanyl overdose?
Oh, absolutely. It's very common now. When people come into treatment, oftentimes the precipitating event may be a fentanyl-related overdose. You're seeing it, just the incidence is higher, the prevalence within our community, within the state, within the country is so much higher. Most people who were, watching us in our conversation today are probably familiar with some of the rates. Fentanyl-related overdoses in the state of Georgia between 2019 to 2021 increased 230% for adults. Here's what's really scary for us. A lot of parents out there, fentanyl-related overdoses between 2019 to 2021, 800% increase for 10-year-olds to 19-year-olds. So yeah, we're seeing it at staggering rates.
But is it too late to attack the problem, or is it something where at least we can kind of put a blanket on it to calm it down?
Having naloxone is like knowing where the fire extinguisher is, right? And it is very effective. It's a very easy to use nasal spray. And if you run across somebody who is not breathing, in the back of our minds, we should always be thinking, is this a drug overdose, right? And so having that, because if you give naloxone to somebody and it's really not an overdose, you haven't hurt them at all. There's nothing, it wouldn't harm them. So you're just crossing that T to make sure that that's not what it was. But it reverses a lot. And in fact, I think of the 1,300 overdoses that Gwinnett County saw in 2022, 800 and some odd of those were reversed with Narcan, 300 of which were reversed before EMS showed up. So the best thing that we can do until we get this fentanyl crisis under control is really to have this life-saving medication in our hands so that we can save lives.
What do we do with this crisis? You've got to have, prevention is a big part of it. Prevention, harm reduction, treatment, and support. And where Narcan, where naloxone comes in, it truly is, it's that harm reduction aspect.
Here's the thing. If I'm with my friend and I see them having an overdose, the pause may be for, oh my God, if I call police, they're gonna know that we've been in here doing something. But that's not the case in Gwinnett County. We're trying to help. Let's talk a little bit about that.
first and foremost, Georgia passed an amnesty law. So if you call for somebody that's having an overdose, or you yourself are having an overdose and you call, you are immune from prosecution. So the police are not going to come and arrest you. And additionally, police are carrying around the naloxone, and they're going to get there faster than the fire department 90% of the time, because there's so many more just out in the field. The fire department has to come from a fire station. Maybe one is close. Almost guaranteed in Gwinnett County, a police car is close, and they're going to bring it with them. So we encourage people to call. Don't fear prosecution, because you are immune under the new Georgia law.
Is there anything else that you all would like to add?
I'll just say that we in Gwinnett County are one of the first in the state to put together a overdose review task force, where it's a committee that gathers to look at individual overdose deaths and say, okay, where were the gaps? What did we miss? Where were the opportunities where we could have made a difference in that person's trajectory, right? Was it resources? Was it access to some kind of resource? Was it, a connection to rehabilitation? Was it some kind of intervention opportunity, right? So when we take these specific cases and look at them individually and as a group, all get together and say, okay, law enforcement and medical examiner and public health and mental health and our school systems and, our colleges, how can we all look at this person and say, okay, I was exposed to her or him, and I could have done this, I could have done that. And so by learning those gaps, we can apply that to other cases and make changes so that we can prevent further lives.
Of course, I can't encourage people to, use drugs recreationally. I can't accept that it's going to happen. If it's going to happen, people should be safe. They should have naloxone. They should not be using recreational drugs alone. And they should not be afraid to call for emergency services if something goes wrong.
Well, thank you so much for joining us. It has been a true honor. I mean, we have Viewpoint, GNR Public Health, Gwinnett Police. I mean, we have more agencies that we couldn't get them all here today, but Gwinnett is really trying to tackle this thing head on before it gets out of control. And it shows the proactive approach we're taking from the very fact that you all made room in your schedule to come here today. So thank you. It is an honor. It is a pleasure. To our audience, thank you so much for joining us on this commemorative inaugural episode of Upfront Gwinnett. Until next time, I'm Deborah Tuff.